So now I'd like to introduce Dr. Joseph Okebe, who has been working with the Cochrane Infectious Diseases Group for a number of years. Joseph is a clinician and a malaria research specialist from the Gambia, and he also works as an editor, particularly on Cochrane malaria reviews. Joseph, over to you.
Thank you, Taryn. So today I'm just going to give an overview of a lot of the work that has happened, particularly regarding malaria chemotherapy guidelines, so particularly focusing on how partnership with the Cochrane Infectious Disease Group has actually contributed to current policy for malaria treatment. Now, I think in 2015, we actually we were able to document evidence. I mean, the WHO documented evidence that actually the burden of disease contributed to malaria actually significantly reduced. And this largely because there's a very strong emphasis on proper case management. And a lot of that is actually driven by the use of the guidelines for malaria treatment. Now, I took this line from that document, and it says that the aim of this guideline is to provide simple, straightforward treatment recommendations that are based on sound evidence that could be applied most effectively in most settings. So in starting my talk, I probably just want to ask us a question: what is sound evidence? And we'll look at one story which I think will kind of set us up on this journey, and that is sound evidence often requires that you have to look at all the evidence, and we find this example with the drug amodiaquine, which actually is used in treatment of malaria. Now, in the early 80s, there was a number of reports that individuals who had been taking this drug as prophylaxis actually had a lot of severe adverse drug reactions, and the resulting effect was that this drug was removed from the essential drug list. Now, it created quite a lot of uncertainties because this drug in some parts of endemic countries was still quite effective in managing uncomplicated malaria. So essentially we had to make a decision in terms of what actually is the evidence behind the use of this drug. And this led to a systematic review of amodiaquine treatment in uncomplicated malaria by colleagues in the Cochrane Infectious Diseases Group. Now, I'm not going to define details of the methodology, but wanted to point out that one of the key things that happened in this review was being able to identify all the trials that had actually been conducted with this drug, irrespective of location or publication status. And this was quite critical because from the review, they were able to identify 40 trials, and over half of these trials actually were not published, and over 20 of them were actually in French, which was quite interesting because most times people tend to look at only English-speaking trials. And I was actually on the strength of this evidence that which showed that amodiaquine was still an effective drug for managing uncomplicated malaria, that this drug actually was reinstated into the WHO essential drug list. Now, the second story I want to talk about in terms of looking at sound evidence is having a strategic approach to evaluation. And a good example is the story of the efficacy of artemisinin-based combinations. Now, this currently is the first-line approach to treatment of uncomplicated malaria. But when the concept actually started, there were quite a lot of trials that were looking at different combinations of artemisinins, and this was, I think it became quite overwhelming at some point. And in order to be able to look at to be able to understand how we can actually evaluate this, there was actually a drive which was led by members on the Cochrane Infectious Disease Group in looking at parameters for understanding individual patient data. And this actually led to a harmonization of protocols, and based on this, it was relatively easy to have a way of looking at data right across all the many trials. And actually it was on the strength of this that the recommendations was, well, relatively approved and adopted, because both from the point of view from the researchers and also those of policy and implementers who had actually bought into the process, this was actually made possible. Now, going back to the treatment guidelines, there have been 3 revisions of the guidelines so far, and actually we see, looking from the first edition, which was in 2006, that the quality and the strength of recommendations actually has evolved. For example, we see in 2006, the level of evidence was simply categorized as ranging from expert opinion or data that was collected from systematic reviews. Now, if we move forward 4 years later, in the second edition, we see very, very clearly that evidence behind the recommendations were actually clean and clear-cut. There was introduction of the grade system, and we find that with each of these recommendations, we had reasonable evidence, and the quality of this evidence was actually, also clear in the guidelines. The current version of the review of the guidelines was published in 2013, and we actually see that there has been substantial involvement of Cochrane systematic reviews in these guidelines, and quite a lot of these reviews actually were led by authors who are living in low-middle income countries where the burden of malaria is actually quite great. And it's actually not a mean feat, because on the average, each review takes between six months to 2 years to perform. But all this actually leads us to actually see that there is significant progress in the quality of the guidelines because of significant contributions to the guidelines based on evidence. Now, first, so I just wanted to, talk in terms of my personal experience as a review author, and just to put things in perspective, that sometimes it's probably not as rosy as one would expect. And this example we find in where there's sometimes potential conflict in what the evidence says and what actually is the opinion of, let's say, the specialists. So the results from a trial in 2006, which was looking at the effect of routine supplements with iron in children living in endemic countries, actually did show that in children that had received iron, there was actually an increased risk of death. And this actually led to very rapid reviews, and the ultimate effect was that iron supplementation was considered harmful and was withdrawn from recommendation. Now, in 2009, some of our colleagues and I, we conducted a systematic review, and we included over 60 trials with over 40,000 children. And interestingly, we did find from this review that there was no effect of iron supplementation on clinical malaria, no effect on mortality, and the increased risk of deaths in these trials only occurred when there was not sufficient provision for malaria surveillance and treatment. And of course, that iron does have potential benefits improving hemoglobin status in these children. Interestingly, this review was largely criticized and rejected by well-known scientists and specialists, and it took 7 years before this review's findings was actually included in the current guidelines. So overall, we could, looking at the landscape of working together, we realized that we actually, to improve health outcomes, it has to be a collective between those that produce the primary research, those who are involved in evidence synthesis, and also those that are involved in policy. And really, we can only make progress when each of these disciplines actually work together toward the target of improving health. So just want to thank and appreciate every person, particularly the support I received over the years from the Cochrane Infectious Disease Group. Thank you.
Thank you, Joseph. Are there any questions or comments? that people would like to make about this process of engaging with the guidelines and supplying evidence. Okay, so thank you very much. So we can move. Thanks very much, Joseph.